Hi, my name is Aaron Canada, and I have erectile dysfunction.
Erectile dysfunction.
Erectile dysfunction.
So one thing I am going to have everybody that I interview do is just say the words erectile dysfunction.
Erectile dysfunction.
Perfect.
So erectile dysfunction is the inability to get and maintain an erection, really with sexual intimacy of any kind, but usually it's the most difficult to get and maintain with intercourse.
So I first noticed the problem when I was 17. But why? I was a pretty healthy guy and I was young. This stuff doesn't happen to young people, does it? Can you think of the youngest patient you've seen come through here?
Oh yeah, I've had 14 or 15-year-olds. Yeah. Some of them are sexually active, which, I'm always hoping that they're not going to be sexually active that early, but a lot of them notice that when they're masturbating, they're not getting good erections. And some of them have good enough relations with their parents that they mention it and they come in.
That's Dr. Michael Werner. He's the medical director for Mays Men's Sexual and Reproductive Health in New York. He's pretty cool. And check out all those degrees and accolades behind him.
Yeah, they're fake. Diploma.com.
Okay, so it can happen when you're young. But how common is it? We reached out to Paul Nelson, founder of franktalk.org, the first and, as far as I know, only online community for men with erectile dysfunction. So can you tell me how common you would estimate ED is?
Interestingly enough, there's just early research, sort of rule of thumb, this is rule of generalization, 20% of men in their 20s, 30% of men in their 30s.
From 40 to 49, 40% of those men have erectile dysfunction. Men in their 50s, 50%. Men in their 60s, 60%. So there's a pretty strong correlation to the decade you're living in, having the same incidence of erectile dysfunction.
That's Dr. Richard Roach. He was the first person I really ever spoke to about ED, even before I started putting this documentary into production. He's also one of the men responsible for a groundbreaking study in the mid-'80s that revolutionized ED treatment a decade before Viagra came on the scene. We'll talk more about that a little later. But it seems to be a commonly held opinion that the number of men affected by ED goes up 10% for every decade of their life. And those are pretty surprising numbers. That averages out to roughly 35 to 40% of men, or 55 million men in America. And if you take that worldwide, that's over 1 billion men afflicted with erectile dysfunction.
And that's just erectile dysfunction, right? Forget premature ejaculation, which is 1 out of 3 men, low libido, low desire, which is 1 out of 4 men, delayed ejaculation, which is 1 out of 5 men. So it's crazy.
Okay, so we established that it's common. But that's a pretty tough pill for me to swallow, because when I first started noticing this problem, I did try to talk to my friends about it, and obviously none of them knew what I was talking about. So growing up, I did think that I was the only one. And up until I started putting this movie into production, I still had never met another person with erectile dysfunction. Why do you think it is so difficult to talk about it?
It's still this macho thing. Erections are a very important part of your self-esteem, and somehow there is not out there sort of the general knowledge that this happens to most men at some age in their life.
Erectile dysfunction is definitely a maleness issue. If I have erectile dysfunction, I don't feel like I'm a full male. Well, they don't want to feel like less of a male publicly and let other people know.
They're afraid that they're going to find out that this part of their life is over, or at least getting an erection good enough for intercourse is over, because you can still have intimacy, of course, without intercourse. And also they're just sort of ashamed of the fact that that's happening to them. Men are very intercourse focused, and what happens, we see a lot, is that so a man starts getting erection issues, then because he's so embarrassed and feeling like that's the only way that he can be intimate, he starts pulling away. He's afraid that every kiss, let's say he's heterosexual, from his wife is going to lead, to her wanting sex, and then he stops being affectionate and warm with her, and then things start falling off.
Guys will say things like, I don't want to start something I can't finish. I don't want to smack her butt. I don't want to give her a lovely kiss. I don't want to get naked with her because that means I won't be able to go through this sequence of events of what sex is supposed to be. So the answer is, if every time I touch her, I'm going, oh, I can't do that. I can't finish it. What's the solution? You stop touching her.
So what causes it? Turns out, a lot of things.
Treatment of hypertension is a very, very common one. Both the hypertension itself and the oral medications used to treat hypertension. Erectile dysfunction is a precursor, red flag, to later cardiovascular disease because the coronary arteries are double the size of the penile arteries. So it takes longer to occlude a 3 to 4 millimeter artery than a 1 to 2 millimeter artery. And I am going around giving more lectures directly to primary care physicians, family practice and internal medicine, especially on the red flag warning that if your patient has erectile dysfunction, within 3 to 5 years, there's, depending on the study, a 44% chance they're going to have their first major cardiovascular event, maybe angina, maybe a full-blown heart attack or a stroke.
Anything that affects your heart is going to affect your penis, and it's going to affect it first. So diabetes, high blood pressure, high cholesterol, obesity, lack of exercise, those are all going to affect it.
The problem is there's not one cause of erectile dysfunction. Everyone's different. This week I've diagnosed 2 or 3 guys with chronic pelvic pain syndrome. They had no idea what it was. Now that's where the pelvic floor muscles are in spasm, but the guys don't even know that they're in spasm. That impinges blood flow, nerve function, and of course, it can really affect erection function.
How about non-physical causes?
Well, psychogenic erectile dysfunction, probably 5 to 10% of all men, that would be the issue. In Wisconsin, their favorite hunting dog would die, and for 3 to 6 months they go into reactive depression and lose their erections.
I had a patient today, off the charts anxiety and depression. He had no idea that everyone in the world didn't feel like that, right? So he was unaware that his anxiety levels were to such an extent that it was affecting his erections. Anxiety's job is to protect you from danger. So the fight or flight hormone, adrenaline, is what kicks in. And you can't run or fight with a raging boner. We love to blame porn. There's all this porn-induced erectile dysfunction. And the fact is, there's a big difference between causality and correlation. So the anti-porn people will tell you watching porn causes erectile dysfunction. I will say there's probably a correlation between watching porn and erectile dysfunction. If a man would rather watch porn and masturbate than have sex with his partner, where does the problem probably lie? Not with the porn. It's the relationship with the partner. There's something going on that's creating anxiety and making it scary to have sex with his partner and safer to watch porn. Maybe he's mad at her. Maybe he feels inferior. Maybe he's not attracted to her. There are a million reasons why a guy would rather watch porn than have sex with his partner. The problem is not the porn. The problem is the solution he's come up with to remain a sexual human being while still being mad at his partner and not having sex with her.
So you can see that there are a bunch of causes, and some misperceptions about causes. The fact is, it's common for a lot of reasons. And the sad fact is, of all the men afflicted, only about 30% will admit it, let alone talk about it. And that's unfortunate, because there are treatments out there that are available, effective, and affordable.
We tend to go from least invasive to most invasive, right? So generally we will start with the oral medications, tadalafil, sildenafil, Stendra, Levitra.
These pills have become generic. The Viagra, the generic is sildenafil, and the Cialis, the generic is tadalafil. Shockingly, and wonderfully cheap.
If they don't work, we will move on to the intracavernosal injections, the injections of the penis. Those are wonderful because the vast majority of men will respond to those. And they're very strong. It's not liquid Viagra. It's a set of drugs that act on the tissue in the penis and fills with blood. So those are great.
Now, those sound terrible. So if you tell men that in order to have sex, they're going to have to put a needle in their penis, they're going to like either not come in or they're not going to think that they could do it. We actually always make sure patients use an auto-injector. There's a 30 gauge needle. Remember, the bigger the number, the smaller the needle. So it's a diabetic needle. It goes in there. They don't even see the needle. They press the button. It gives the injection on the side of the penis, not the top, not the inside. And they can get remarkably good erections. The most aggressive thing, but the one that always works, is the placement of a penile prosthesis. And those we usually reserve for men where the non-surgical things are not working. But the men love them.
So the treatments are there. They're easily available and they're affordable. And to me at least, the most complete and best value option is the injection therapy. And that brings us back to Dr. Roach and the study that we mentioned earlier.
It was my research project at UW-Madison back in the mid-1980s that proved to the world it worked. I took it upon myself to do the first double-blind crossover study. We took 30 vets from the VA hospital practice next to University of Wisconsin. We sent them out with normal saline. It was double-blind. They didn't know if they had the normal saline or the actual vasodilator. And 30 out of 30 came back after injecting the normal saline with 0 erections. And it was like, hey doc, what was all that about? And then we sent them out with the vasodilator. 29 out of 30 got excellent erections. And some of these guys hadn't had erections for up to 5 years. So we proved to the world that self-intracavernous injection definitely works.
So that naturally is a transition for me into these clinics.
Oh, we guarantee you'll get an erection. Yeah.
If Viagra, Cialis, or Levitra have let you down, Men's Medical Center has patients lasting 30, 60, 90 minutes or longer. You'll see results on your first visit, guaranteed, or your first visit is free. And best of all, it's affordable.
Right. And here in New York, one of the radio stations on one of the sports radios, they advertise like crazy. So all these middle-aged men are listening to baseball and they're hearing about this clinic that guarantees erections. Of course they're going to go.
Considering your background and the fact that you were on the leading edge of penile injections being a legitimate treatment, how disappointing is it that now there are clinics out there using the same treatment to, I would say, swindle men out of thousands of dollars when they could be getting it at a very affordable price?
Yeah, that really hurts. Ethically, it hurts that the medical profession would do that to scam patients and extort financial resources from them.
I do have a doctor friend who says, listen, if they're delivering erections and people are willing to pay $2,000 or $3,000, then that's what the market will bear. The problem is the medication they're getting, your urologist can get for $80, $90, $150.
They serve a purpose, but they should do it at a more fair price like we do. Same end result, but thousands of dollars versus hundreds of dollars, and 10 vials for $3,000 versus 10 vials for times $80 or $90, big difference.
$800 to $900 versus $3,000.
Yeah.
It's pretty big markup.
Yeah.
My other problem is they're sort of mills. They're generally not board certified urologists. As long as they have an MD behind the desk, it's just a factory and you go in and they sell you the injections. And yeah, injections are great. They work for a huge percentage of men. It's just, first of all, what we don't get is a live diagnosis. Have we done all the diagnosing what's going on with their heart, with their blood, with their diabetes, with all the other health aspects? Are they anxious? Are they depressed? You need to treat mental health issues. So they're getting men an erection, but in an island or just in one little silo, and we're not looking at the whole person. So are they doing anything dangerous? Probably not. Are they getting erections? Probably. Is it great sexual medicine care? Probably not. So you don't need to spend that kind of money. The American medical system is failing these men if these clinics are successful, because these men should be going to board certified sexual medicine specialists who are then screening them for every other possible cause of ED instead of just like, oh, you can't get an erection, we'll give you one.
So what did we learn today? Number 1, ED is common. Number 2, there are treatments that are safe, affordable, and readily available. And number 3, there are people and organizations out there who are ready and willing to take advantage of you. So do your research and protect yourself. And one more thing, an ED diagnosis is not the end of your life.
When we lose hope in life, that's the worst place to be. It's like we all have bad days, but we have hope that things will get better. We have a plan, we have a place. And when men feel isolated, despondent, there is no hope, that's when severe depression and suicide ideation creeps in.
Really, I love my practice, love, right? Because I can look someone in the eye when they're coming in with guard variety, straightforward erection issues, even if they failed almost everywhere else, is that we can always get a man an erection. So there's literally no reason for them to be dismayed.
Don't give up. As a medical center, we can give erections even after you're dead. We can give you a boner. That's easy. Frank Talk has a physician finder listing, so you can find a sexual medicine expert. Don't give up.
So talk about it. You are not alone, and there is no reason to suffer in silence. There is hope, and there is help, and all you have to do to get started is talk about it.